let's dive right into a really high-stakes scenario. We're talking about central nervous system infections. And this isn't just some textbook topic. For doctors and patients, it is a desperate race against time where literally every single second is critical. So I want you to think about this for a second. Your body has this incredible command center, right? A biological fortress that's designed to be super secure. But what happens when that fortress gets breached? Well, the consequences can be absolutely catastrophic. And that fortress, that's your central nervous system, or CNS for short. It's your brain and your spinal cord, the very essence of who you are. It's built to keep invaders out, but sometimes even the best defenses can fail. And when those defenses do fall, the CNS becomes a fortress under siege. We're talking dangerous microbes, bacteria, viruses, you name it, invading this incredibly critical space. And that triggers a life-threatening emergency. So, who are the culprits? Well, here's a bit of a rogues gallery of the usual suspects. You've got notorious bacteria like Streptococcus pneumoniae and viruses like herpes simplex. Believe me, these aren't just your average germs. They are incredibly dangerous when they get into the wrong place. Now, for the clinicians on the front line, this is no longer a theoretical problem. It's a full-blown, immediate crisis. The second a patient shows symptoms, a clock starts ticking, and a life is hanging in the balance. So how in the world do you fight an enemy you haven't even properly identified yet? You use a strategy called empiric therapy. The best way to think about it is as a doctor's first best educated guess. It's all about launching a powerful counterattack based on the most likely suspects without waiting for all the evidence to come back from the lab. And the sheer urgency of this is perfectly captured in this quote from medical guidelines. It says, "Antibiotics should be started as soon as possible, period." You don't wait for a scan, you don't hesitate for a lab result, you act, because any delay could be the difference between life and death. Now, it's not a wild guess, not at all. There's a very clear, methodical process. First, the doctor makes a clinical diagnosis based on the symptoms they're seeing. Then, they consider the likely culprits. What's the probable cause? Step 3, they select the right broad-spectrum antibiotic to cover those bases. And then finally, once the lab results are in, they switch gears and de-escalate to a highly targeted therapy. Okay, this is where the detective work gets really fascinating. Each type of CNS infection is kind of like a different case file, and each one needs a unique strategy to crack it. Let's open up our first case file, meningitis. You've probably heard of it. It's an inflammation of the membranes around the brain and spinal cord. And let me tell you, it is one of the most feared CNS infections for a very good reason. The initial game plan, that empiric therapy, it really depends on the patient. For most adults, doctors will start with a 1-2 punch of ceftriaxone and vancomycin. But if a patient is over 50 or has a weakened immune system, the risk from different, more resistant bacteria goes up. So they escalate to a more powerful combination, meropenem and vancomycin. For a typical case of bacterial meningitis, the patient is looking at a pretty intense course of treatment that lasts about 10 to 14 days. And of course, more complex infections can mean an even longer battle. All right, next up, we have a different kind of threat entirely. Let's open the case file for a brain abscess. This is a very localized infection, basically a collection of pus inside the brain itself. As you can imagine, it presents a whole new set of challenges. And here, the strategy shifts based on how stable the patient is and how big that abscess is. If the patient is stable and the abscess is pretty small, treatment might start with ceftriaxone plus metronidazole. But if they're unstable, the playbook calls for bringing out the big guns immediately, that heavy-hitting duo of meropenem and vancomycin. And look at the timeline here. The treatment is so much longer and more variable. We're talking anywhere from 3 to 12 weeks. That's a significantly longer and tougher fight, all depending on how the patient and the abscess respond. So you might be wondering, where do all these rules come from? Doctors aren't just making them up on the fly. They come from an official, standardized playbook designed to make sure every single patient gets the absolute best care possible. In India, for example, this playbook was developed by 2 major organizations working together, the National Center for Disease Control, the NCDC, and the Indian Council of Medical Research, or ICMR. Their collaboration created a national standard for treating these incredibly dangerous infections. And the purpose behind it all?
It's crystal clear. These guidelines help doctors make that critical first decision with empiric therapy. They create consistency in treatment, whether you're in one city or another. And ultimately, they're about ensuring timely care and optimizing how we use our precious antimicrobials.
But this whole thing is bigger than just treating one patient. Following this playbook has a much, much broader impact on all of our health. Let's dig into why these rules really, truly matter.
The core strategy really just boils down to two simple steps. It starts with empiric therapy. You have to act fast with a broad attack. But then, once you've identified the specific intruder from those lab results, you switch to targeted therapy. Now you can act smart with a narrow precision weapon. And this act fast, then act smart approach, it's not just about saving one person. By promoting the responsible use of antibiotics, by shifting from those broad-spectrum drugs to targeted ones as soon as possible, these guidelines become a vital weapon in the global fight against antimicrobial resistance. They really do protect all of us. Which kind of leaves us with one final, big question to chew on. In this constant, invisible war we're fighting against microbes that are always changing, always evolving, is a smart, evidence-based playbook our single most important weapon? Something to think about. Thanks for joining me.